is suggesting connective tissue is going to be connecting in nature. Like if you want to connect a muscle with the bone, there'll be a tendon. In the tendon, you'll have the connective tissue. The bone itself is a connective tissue. Cartilage is also having connective tissue. When you look at the basic architecture, connective tissue will have some cells and some fibers. And we want to look at the different type of fibers which we can have in the connective tissue. Our discussion goes always focusing upon the type of questions we get in the exam. So what are the different type of fibers we can talk about? In the connective tissue, they are collagen fibers, and it could be elastic fibers. And then we have the third type, which is rarely found, are the reticular fibers. Then what are the features of collagen fibers? Since we are going to compare them with the other two, you can start by mentioning the collagen fibers are long, wavy bundle of fibers. Like you will see them here, they always run in group bundles. And as you mentioned, they are long, wavy bundle of fibers, and they are not branching. Now, these are the features we require because we are comparing them with the elastic fibers. But where do you find collagen fibers? The collagen fibers can be seen in the bone, in the cartilage, in the tendon, ligaments, giving strength to the structures. And what about the elastic fibers? Elastic fibers, as the name is suggesting, they have elastic nature. They can be deformed and will regain their form. For example, in the lungs, you have elastic tissue. In the aorta, it is an elastic artery. So when the lungs are expanding, they can be deformed and they can be expanding. Because of that elasticity, they regain their original structure. Similarly, when there is a large amount of blood being pushed into aorta, it will be dilating, but it can come back to its original shape. So elasticity is important at certain places, and that is where we'll have the elastic fibers. As you compare them with the collagen fibers, you can remember SSSB. And what is this SSSB? If you look at these fibers, they are having a peculiar feature, like they are short in length, they are straight, not wavy, and they are single, not in bundles. And B means they are branching. So as we have mentioned, elastic fibers are short in length compared with collagen fibers, which are comparatively longer. Then they are straight, not wavy, as you see the wavy bundle of collagen fibers, and they are singly running, not in bundles as you find in collagen fibers. And we have said collagen fibers do not branch, but the elastic fibers, they are seen to be branching. Now, what about the reticular fibers? The reticular fibers are actually type of collagen fibers. Collagen fibers are several types, and if you look at the type 3 collagen fibers, they are given the name reticular fibers. They make a reticulum or a network in certain organs, like lymphoid organs, in the liver, in the lymph node, in the spleen. They give a framework. You can mention here the reticular fibers are making a network of fibers, giving a framework, and which can be seen in organs like the lymphoid organs. Maybe it is the liver, the spleen, the lymph node, and as we mentioned, they are type 3 collagen fibers. They are rarely occurring fibers. Now let us move on further and describe various types of connective tissue along with the location where they can be found. So connective tissue can be classified as loose connective tissue and dense connective tissue. How do you describe them? Loose means you will have less of fibers. In the dense, you'll have more of fibers. And obviously, when you have less of fibers in loose connective tissue, you'll have more of cellular components. Cells are more in number. Whereas if you are having more of fibers, then it becomes dense connective tissue and less of cellular component. Now, under the subclassification, you remember two types under the loose connective tissue. Like you have got loose areolar connective tissue, and the other one is reticular tissue, as we have seen in the lymphoid organs. So loose areolar connective tissue and reticular tissue, this is the loose subclassification. What about the dense connective tissue? There you can remember two, one of them being dense regular connective tissue and the dense irregular connective tissue. Now let us proceed further with their diagrammatic representation. We are starting with the very first, loose areolar connective tissue. Here we find the loose areolar connective tissue, where we will see less of fibers and more of cells. The cells could be fibrocytes, macrophages, mast cells. They'll be more in number comparatively when you're comparing the loose irregular connective tissue with the dense connective tissue. Now, can you give example of loose irregular connective tissue? Yes, under the epithelium, subepithelial connective tissue. For example, lamina propria. Now, when you talk about the lamina propria, which is subepithelial connective tissue, which kind of fibers you find there? The fibers could be collagen fibers, elastic fibers. And how do you identify the collagen fibers? The collagen fibers are actually running in bundles, as you see, long, wavy bundle of fibers, as evident here. Then, what about the elastic fibers? Elastic fibers we have seen, they run singly. They are short, they are straight, they are branching. If you remember SSSB, what is the extension of the abbreviation? They are single, not in bundles, like the collagen fibers. And then they are short, not long, as collagen fibers. And straight, they are not wavy bundles, and be branching. So, as you can see, the elastic fibers are running singly, they are short, they are straight, and they keep branching. Now, this was about the loose irregular connective tissue. Let us look at one more type, which also comes under the classification of loose connective tissue. As we mentioned, the reticular connective tissue having the reticular fibers can be seen forming framework, like in the lymphoid tissue. We have given the example of liver, spleen, lymph node, and we also mentioned that reticular fibers are type 3 collagen fibers, but they do not have the feature of collagen fiber as such. They are basically going to form a network, a framework, as evident here, and there can be cells like lymphocytes in the lymphoid organs. To keep those lymphocytes, you are giving a framework. So the reticular connective tissue, and it is a rare type of fibers which we find as compared with collagen or elastic fibers. Now we move on to the diagrams of the dense connective tissue. Here it is dense regular connective tissue. What do you mean by dense? Dense means you have more of fibers. And what is meant by regular? It means the fibers are running in a regular fashion. As you can see, these are the collagen fibers, long wavy bundle of fibers, and they are running parallel to each other in a regular fashion, going in a particular direction. As you find in this diagram, it is a tendon connecting muscle with the bone. It can also be a ligament. So tendon or ligament, where you see bundle of fibers, they have to run in one particular direction. So as you can have proper physical pull, a proper connecting component. You can differentiate it from the dense but irregular connective tissue. Now, when we talk about the dense irregular connective tissue, it is also having more of fibers. That is why we are telling it is dense. But this time the fibers, they are not running in groups in particular direction. The fibers are collagen fibers running in various directions, north, east, west, south. They do not have a particular direction of movement. And where do you find such an arrangement of collagen fibers? The dense irregular connective tissue can be seen in coverings of structures like on the bone, periosteum, on the cartilage, perichondrium. As you can see, the periosteum, the perichondrium, and it is also seen in the deep dermis. When you say it is in the deep dermis, which layer of dermis? Because dermis has two layers. It is the deep reticular layer of dermis. Now, if you are looking at the deep reticular layer of dermis, there you are having dense but irregular connective tissue. What about the superficial papillary layer of dermis? In the superficial papillary layer of dermis, you see this is subepithelial connective tissue. Below the skin epithelium, you have subepithelial connective tissue, papillary layer of dermis, that is loose areolar connective tissue. We have discussed that earlier as well. But be careful, if you talk about the dermis, the papillary layer is very small component. Most of the dermis is deep reticular layer of dermis. And that is where we have the dense but irregular connective tissue. Let us now write down all these details ourselves and do kind of a revision. And as we classify the connective tissue, we have seen it can be loose connective tissue tissue or dense connective tissue. When we say the loose connective tissue, it means less of fibers, whereas if it is dense connective tissue, you have more of fibers. Now, they can be further subclassified. We have mentioned in the loose connective tissue, there can be loose areolar connective tissue and reticular tissue. And under the loose areolar connective tissue, we have seen less of fibers, more of cells. Two examples we have seen: sub-epithelial connective tissue. When you are talking about these examples, the sub-epithelial connective tissue, one of them was lamina propria, like you will find in the gut tube, respiratory tube, under the epithelium, loose areolar connective tissue. And one more example of subepithelial connective tissue, we have discussed superficial papillary layer of dermis in the skin, the subepithelial connective tissue. And under the reticular connective tissue, we have mentioned the framework forming structure in liver, in the lymph node, in the spleen. Now, as we are comparing the loose connective tissue with the dense connective tissue, what are the two subtypes? Dense irregular connective tissue and the dense regular connective tissue. Now, one example for dense irregular connective tissue. Why do you call it as irregular? Because here you have dense arrangement, means more of fibers, but those fibers are arranged in irregular fashion. As you will notice, the collagen fibers are there, but they are not running in one particular direction. They are arranged haphazard, hence the name irregular. And we have seen the example, deep reticular layer of dermis. So we have mentioned if it is the superficial papillary layer of dermis, then it was loose areolar connective tissue. But if it comes to deep reticular layer of dermis, there you have dense but irregular connective tissue. And two more examples, as you saw, around the bone, periosteum, around the cartilage, the perichondrium, even the periosteum and perichondrium, they are examples of dense irregular connective tissue. Now, coming to the dense regular connective tissue, where you have the collagen fibers running in a regular fashion parallel to each other. And examples, we have mentioned structures like the tendon or the ligament. We can mention a flat tendon also comes as a question, the flat tendon aponeurosis. So let us look at a question itself where we are supposed to remember this kind of information to find out the appropriate answer. As we find, this question is asking dense and regular arrangement of collagen fibers seen in all except. So as we know already, if we are talking about dense and regular arrangement, we have seen three examples. We were talking about the tendon and a flat tendon which is called aponeurosis. Even the ligaments, they are dense and regular. So does that mean the answer is choice number D? Yes, may it be the periosteum or the perichondrium. They are under the category dense but irregular connective tissue. Hence the answer of exception. Actually, we have got the similar type of question. Let us move on to that, keeping the answer as choice number D. And this question is asking dense but irregular connective tissue. So as we continue our discussion and talk about the dermis, dermis is actually having two layers. There is a superficial layer and there is a deep layer, which is more thicker. The superficial layer is thin as compared with the deeper layer, which is thick. In the superficial layer of dermis, which is called as the papillary layer of dermis, we have got what is called as loose areolar connective tissue. And what about the deep reticular layer of dermis? In the deep reticular layer of dermis, that is where we have got dense irregular connective tissue. So, are you trying to say your answer will be choice number A, dermis? Yeah, maybe. Let us look at the other options as well. What about the lamina propria? Lamina propria is the subepithelial connective tissue. And the subepithelial connective tissue, like in gut tube, respiratory tube, renal tube, genital tube, the subepithelial connective tissue is loose areolar connective tissue. But this question is upon the dense connective tissue. So this cannot be our answer. Then what about the tendon and ligament? They are dense connective tissue. Tendon, ligament, or the flat tendon aponeurosis, all the three are dense but regular connective tissue. Since they are dense regular connective tissue and our question is on the dense irregular connective tissue, the only possible answer is choice number A. Despite knowing that the dermis could be loose irregular connective tissue and also dense irregular connective tissue, there is no other possible answer. So we have to keep our answer as choice number A. And also understand that in the dermis, there is a very thin layer of superficial papillary layer, which is loose irregular connective tissue. Most of the dermis is deep reticular layer, the dense irregular connective tissue. Hence, we keep our answer as choice number A here. No other option is fitting well here except choice A. So that should be our answer then. Now we'll be making a table where we will discuss 4 types of collagen fibers. As I mentioned, our discussion is based upon the type of questions we keep getting. So here you can make the table mentioning type 1, 2, 3 and 4 collagen. In this, the type 1 is the most common type of collagen. And where do we find this type 1 collagen? It can be seen in the bone and the tendon, the ligament connecting to the bone. So tendons and ligaments, they have predominantly type 1 collagen? Yes. Then what about the cartilages? Cartilages will have predominantly type 2 collagen. You can mention the type 2 collagen is found in the cartilages, especially the hyaline cartilage and the elastic cartilage. Then what about the third variety, the fibrocartilage? Fibrocartilage is considered as atypical cartilage and you have to keep it along with the bone. We have to keep the fibrocartilage along with the bone. Why? Because we consider it as atypical cartilage. But why would you say that fibrocartilage is atypical cartilage? Because it does not have the features of the regular cartilage, hyaline and elastic cartilage. It has the features similar to the bone. Similar to bone like what? Like fibrocartilage has predominantly type 1 collagen and the fibrocartilage has neurovascular bundle in the similar fashion as the bone. Okay, so what about the hyaline and elastic cartilage? Hyaline and elastic cartilage, they are avascular. They do not have any nerve tissue, no neurovascular bundle. So we are considering fibrocartilage is atypical cartilage, having similar features like that of bone. Then where do you find the type 3 collagen fibers? If you remember, we have already mentioned reticular fibers. The reticular fibers are the type 3 collagen fibers. And we also mentioned they are rare type of collagen fibers. Where do we find the type 3 collagen fiber, reticular fibers? Forming the framework. If you remember, we have discussed lymphoid organs like the liver, the lymph node, the spleen. A question comes and it will be asking which of the lymphoid organ is not having a framework of reticular fibers, and your answer will be thymus. Thymus is a lymphoid organ, but it does not have a framework formed of reticular fibers. Otherwise, usually the lymphoid organs will have a framework of reticular fibers. Thymus being an exception, and exception coming as question. Where do you find the type 4 collagen? You can mention basement membrane. Now, when you say basement membrane will have the type 4 collagen fiber, there can be some collagenopathies which you will discuss in pathology. One question has come. When there is a recent healing tissue, which type of collagen fibers will you find there? The granulation tissue. Granulation tissue will have type 3 collagen fibers you can mention. Now, the recent healing granulation tissue you are mentioning is having type 3 collagen. What about the old scar tissue? That is also one MCQ. If it is old scar tissue, then type 1 collagen you can mention. Here you can mention old scar tissue, the type 1 collagen fiber. And here only you mention in the skin dermis. Another question again, more than 80% fibers are type 1 collagen. So more than 80% fibers in the skin dermis are type 1 collagen fibers. See, the point is when you keep practicing multiple MCQs and since they keep on repeating, you must memorize some of the examples well, like type 1 collagen you're finding in bone and fibrocartilage, the atypical cartilage, and it is also found in tendon ligament, the old scar tissue. In the skin dermis, mostly it is type 1 collagen fibers. And then later you can also talk about some of the collagenopathies where different type of collagen fibers are involved.